Hello everyone. From today, we will launch a series of introductory lectures on OCT. Today is the 7th lecture of the course, where we will introduce optical coherence tomography and the image interpretation. I am Dr. Kong Ling Kui, PhD, from the Department of Cardiology at Zhongshan Hospital, Fudan University. Beyond this classification, we also grade neointimal coverage by its thickness, using 100 micrometers and 200 micrometers as standardized thresholds. Specifically, grade 0 means no neointimal coverage. Grade 1 indicates the thickness smaller than 100 micrometers. Grade 3 is larger than 200 micrometers, with grade 2 in between. This is our quantitative evaluation framework. Morphologically, neointima can be categorized as homogeneous or heterogeneous. Homogeneous neointima is composed predominantly of smooth muscle cells. This pattern is typically observed in early-stage, bare metal stents, as a characteristic finding. In contrast, layered or heterogeneous plaque, with complex plaque composition, is more frequently associated with drug-eluting stents. OCT facilitates a quantitative assessment of neointimal coverage thickness, plaque morphological characterization, and stent shape. This assessment provides insights into the pathological mechanisms of in-stent restenosis, ISR, thereby informing evidence-based therapeutic decision-making. Regarding optimal predictors of stent thrombus, the strut coverage rate should be less than 70%. In other words, if the uncovered struts per cross-section exceed 30%, it indicates a significant thrombotic risk marker. This is a case of in-stent restenosis. It demonstrates typical neointimal hyperplasia with homogeneous plaque composition. Following cutting balloon treatment, stent deployment is performed to effectively address the stenosis. This case demonstrates similar findings. Homogeneous neointimal plaque in a patient with a bare metal stent. The following cases illustrate distinct pathological features. The middle figure shows extensive lipid plaque with thin fibrous cap, indicating neotherosclerosis. These patients exhibit fundamentally different ISR mechanisms, requiring tailored treatment approaches. That's all for today.